Hey guys, in this video I want to talk about the anatomy of a hot flash. Okay, what actually is it? What the common remedy in medicine is estrogen, like hormone replacement therapy, or just estrogen. And I'm going to tell you why that works, but it comes with a package, and I'm not recommending it. Okay, but again, anything that I recommend, just check with your doctor. That's my disclaimer. Okay, you have this endocrine pathway in the body. It starts from the hypothalamus. It's a little tiny little gland up in the brain, with a bunch of little cells that have pre-programmed messages that run different functions. And then this is like the master gland. It's like the owner of the football team. Then you have the pituitary. Okay, that's like the coach of the football team. So we have the owner that sends the message down, and the pituitary then sends down messages to the different glands. So it kind of splits off. So you like maybe have the CEO and the office manager. Okay, so they're both in coordination. So the messages up here in this little tiny speck of a nerve bundle up here has messages that are in a timing system. Okay, every month, okay, release the egg from the ovaries down here, and we have this whole communication. That's the messages are sent down, it gets received, and then once it gets received, it sends back the message telling it, I got your message, you can turn it off. Okay, so that way we have this on-off feedback loop. Okay, and that's why even if you talk to someone and they're ignoring you, you might continue to talk or increase your volume, because the acknowledgement is the turn-off switch. It's like, okay, I heard you, thank you, you can stop talking now. Okay, so we have this whole thing going, and then at age 52, maybe a little before, a little after, you run out of eggs. Okay, you have 400 eggs, you're done, you're in retirement, the ovaries are in retirement, and so they turn off. Okay, so what happens, so now the message should normally just shut this off and everything should be fine, because there's a backup organ. The adrenal glands, which are on top of the kidney, produce the same hormones as the ovaries. They're the backup to the ovaries. And typically what happens during menopause, you don't need the full set of ovarian hormones. You need some, but you don't need a large amount, because you're not going to have babies anymore. Well, maybe you might, but maybe you might not. But the point is that if these adrenal glands do not back up the ovaries with the hormones, if they don't supply enough, let's say they're weak, adrenal fatigue, and you go into menopause, you get the failure to the backup, and you kind of short circuits this whole pathway. So now we don't get this feedback loop. So now the hypothalamus is sending down excessive signals down to the adrenals, try to kick them in gear, and that overstimulates the inside of the adrenal, which creates a little spike in adrenaline. So your heart rate starts going up. You start sweating. So you have all these flashes of heat that go down. So that's really what causes the hot flash, is a failure for the adrenals to back up the ovaries. Okay, and so what can you do? Well, you want to support the adrenals. I put a link with some ideas down below if you want to check it out and read up on it. But in this video, I just wanted to show the anatomy of what a hot flash really is. It's really simply an adrenal weakness. That's it. All right, thanks for watching.